concepts of like Microsoft, they have the new Fabric. And so the concept is being able to put all your data in one place and let the AI figure out all the normalizations and all the connections and all the keys and all this. And so really kind of turning over that vast problem that is, humans can't do. It's a perfect place for AI to be. So I think that as we're now building out these huge, large data centers, we're building out the storage capacity, it's the AI that's going to then be able to figure out. Because what I always say is, you never, when you get a report of something or something, you're never looking really for data, you're really looking for an answer.
Yeah.
And so if we can leap directly to answer with the talking to the AI, which is I think where we're getting, I think they'll make a huge difference and let us actually leverage that huge data set.
Another episode of AI Got This. So super excited today. We're going to focus a little bit on healthcare and the role that AI plays in the healthcare space. And we've got two great guests, Shuss and John Bozin are with us. And maybe you guys could take a minute and just introduce yourselves really quick, and then we'll just dive right in.
John, go for it.
Yeah, so I'm John Bozin. I'm a healthcare leader in our consulting services division. And I've worked all across healthcare as a CEO, COO, CFO, and also worked in health and human services. And excited to talk about AI and things I'm seeing that are happening today and where I think it's going to take the industry.
Awesome. Eric?
Great. Yeah, my name's Shuss. I'm a solution architect here at Armanino, but my passion has always been artificial intelligence. So I've been working in artificial intelligence for about 25 years now. Very excited with what's happening right now, this explosion of the large language models and the generative AI. So that's all very exciting to see finally come to fruition after so many years watching it. And also very excited, interested in the concept of AGI, the artificial general intelligence. Yeah, should have a fun conversation about healthcare.
Awesome. That's amazing. And I'm just going to say off the jump here, 25 years spent in AI. You've got to be looking at this right now with a little bit of mind blown. We finally made it, right? Like I have a keynote next week at a conference, and we were able to deploy a co-pilot small language model for this customer in like less than a day, right? Like, is that just like, when you think about that, is that just mind blowing right now when we talk about how far we've come and where the technology is?
Yeah, I mean, projects that used to take months and months, if not years, with data scientists just struggling and slaving away, has now just made this huge leap. And you're exactly right, Carmel. We've gone through these hype cycles since the 80s, 90s. We keep going through these where you think AI is coming, it's going to be the greatest thing ever, it's going to be fantastic, and then you fall down into the pits of desperation as it goes away. And it's funny because there's many technologies I've worked with that, like 3D printing, VR, have all go through these hype cycles, and we're all sure that this is going to be the killer app. And this is really where the killer app has landed for the first one for AI. This really has changed everything.
Yeah, it's kind of amazing. I love to see it. So John, maybe talk a little bit about what you're seeing in the industry right now. Like, are people excited about this? Is this like Minority Report scary? What are we talking about?
Very excited. And I think kind of draw on what Eric was just talking about as well, is, over the last, probably say 15 to 20 years, there's been so many concepts and theories about where healthcare is going to go as an industry, the business of healthcare, talking about payment models and potential technology. And now technology has caught up to the dreams. And so there's, we're in the stage of reality, and it's incredible to really think about I'd say that the potential the AI has to really shift our focus from reactive to proactive in healthcare. Mm-hmm. That's, I think, the really sort of the cornerstone here is that there are some really notable examples that are things that are happening today, automating tasks, doing things like that, and just kind of improving patient outcomes, streamlining processes. A lot of stuff's being done today in radiology. Easy to kind of use those systems to maybe detect abnormalities, but mostly just focusing on accuracy, efficiency, and speeding up diagnosis and reducing, the likelihood of human error. So it's primed, it's perfect for healthcare.
Yeah, it's interesting too, because when you think about healthcare 20 years ago in an operating room, as an example, right? And I think healthcare has done an amazing job of really taking the latest and greatest technology and being able to utilize it in an operating room type setting. I mean,
About.
I have real world examples of this from, surgeries 20 years ago and something more recent. And the recovery was incredible and the process was incredible, right? It's what used to be an inpatient thing is now an outpatient thing. And I mean, that's amazing. But we haven't seen a lot of adoption outside of that particular function from an AI and how I think about technology in healthcare. So in what areas, when you talk about this, are you guys seeing, okay, we're starting to hear people say we want to adopt it in these areas? Like, what can you be more specific about some of the examples that you
I
see?
definitely can. Yeah, I can. And Eric's probably dying to say some things about that as well. But I can tell you, so on the front side of business, or front side of healthcare, clinically and operationally, that's one thing. But I can tell you for sure, as the healthcare systems are going sort of more complex and there are increasing sort of administrative and business functions and burdens there, all the back office functions, right? That's just a great area for us to focus on in terms of medical billing, claims, things like that. They're ripe for things that where you can just leverage this type of technology again to create efficiency, to leverage the true aspects of human abilities on things that should be focused on, and not keying and punching and doing the traditional business activities. So I don't know if Eric wants to talk maybe on that as well.
Yeah, I mean, I think that's where this is coming so quickly. And again, traditionally, healthcare has been fantastic. As you said, the Da Vinci robots and all that robotics really took huge leaps in the operating room. But what about the hallways outside?
Right.
So one of the things that kind of we're working on is kind of an exciting concept of basically using IoT and AI to help doctors and nurses be able to have the right resources and equipment in the right place, and be able to quickly and easily report that there's a problem with them. Because working with one of a large NTT Global, their innovation division had a customer come to them and say, one of our biggest problems is these carts, these WOW carts are called, workstations on wheels. We're breaking down, and nobody has time to go put a service ticket in. They basically just throw them to the side. Maybe someone's lucky you put a sticky note on it. So we were basically charged with, is there a way to solve this problem? And working with kind of doing some work with different healthcare companies, and we've come up with a concept of using IoT and AI. So basically you can have a device that's on any piece of equipment, push the button, and the AI basically can ask, you're having a problem with this equipment, would you like me to create a service ticket, or would you like to troubleshoot it with me? And basically be able to give them a solution right there to how this piece of equipment has had this before, do this to fix it. And using the AI to be that AI assistant, tech assistant for each piece of equipment be different. And even the concept of having speakers on that listening to the equipment and being able to just hear error codes or fan going and automatically create a predictive maintenance ticket. So some really cool stuff using AI to do things like predictive maintenance, but also trying to make it as easy as possible for people to interact with the equipment.
And I love those examples, right? So, because when we think about back office, we typically think about the financial things, and like you mentioned, John, maybe the medical coding and some of the billing and things like that, and it's where our head usually goes. But I think sometimes we forget that there's a whole other back office that's managing, keeping the lights on and the servers going and the WOW carts moving along and I don't know about y'all, but I do see those piled up in the corner when you go into a large healthcare facility, right? Where you're like, what's going on over there? IT hasn't gotten to that yet, right? So not their fault is all of our problem, right? And I think it's super, I love that we're having creative ways of solving that. Sticky notes, super high tech, man, like that was awesome 10 years ago, right? Let's move on. So that's pretty good. And then, so, I mean, one of the things that we talk about internally here all the time is we think about, John, this is going to be more around the example that you use, but the way that a hospital does collections or a healthcare organization does collections between the payer, the insurance companies, the broker, and all of those things, it's very complicated. And we see that money's left on the table on a regular basis for that, where we're not able to collect 100% of whatever the visit or procedure was. Can you talk a little bit about how you think we're attacking that problem?
Yes, that's a great example there. So I would call it really just AI powered coding. So that's just really focusing on streamlining, reducing errors, and identifying, in general, missed revenue. So there's an opportunity to do automated coding. So these AI powered systems really sort of for accurate code generation, reducing coding workloads, improving accuracy around a lot of coding. There's just a lot of opportunity to either code up or code down. So when you're pulling that human component out of there, you're just going to have improved accuracy. There's a lot of opportunities around sort of missed revenue detection. So you can have AI algorithms to kind of just identify undercoding and these missed billable services. And I think also just enhancing compliance, maintaining compliance with regulations and guidelines. Coding is such, it's an arduous task to try to code these notes. And when you can use a framework to, not only do the coding, but I think also to learn from the coding and synthesize that information. And, healthcare is about being really a learning entity. So when you can turn this and learn from it and get better, faster, and that regenerative piece of it, and this is exactly what healthcare is about. And I wanted to kind of take this as an interesting thing. So some of the core principles around the U.S. healthcare system, especially in terms of like Health and Human Services and the Center for Medicare and Medicaid Services, Medicare Services and Medicaid Services, is they've got something called the triple. It used to be the triple constraint. It's now the quadruple constraint, and it's scope, time, cost, and quality. So when you're really thinking about taking and advancing the U.S. healthcare, this is exactly it. It's about making sure it's in scope. The AI can really focus on the time components, but it's a lot about cost and quality. So I mean, it's here, and there's just a lot of opportunity to advance the business and transform the business of healthcare.
Yeah, I love that. I love that. Okay, I'm going to pivot just a little bit because I think there's an interesting thing too in that when we look at healthcare as a whole, we're generating more data than almost any other industry. The sheer volumes of data are mind-boggling. And so when you guys think about that, knowing your, like Eric, your AI background and what you think about predictive analytics, and John, you and I have talked about this a number of times, but what are the things that healthcare organizations should be thinking about from a data perspective, and how do they start utilizing that data in a way that is going to really be meaningful to maybe an AI practice and or the learning part of the organization? Because it's so vast that I feel like part of it feels like a really overwhelming task to go look at that now, right? Like, how do I attack petabytes of data? Like, hard.
Yeah, Eric, you want to jump on there a little bit?
Yeah, I mean, I think it's that fantastic opportunity and that fantastic challenge we have. But since what AI really is a pattern matching, monster that can do that better than any of us. Concepts of like Microsoft, they have the new Fabric, and so the concept is being able to put all your data in one place and let the AI figure out all the normalizations and all the connections and all the keys and all this. And so really kind of turning over that vast problem that is, humans can't do. It's a perfect place for AI to be. So I think that as we're now building out these huge, large data centers, we're building out the storage capacity. It's the AI that's going to then be able to figure out. Because what I always say is, you never, when you get a report of something, you're never looking really for data. You're really looking for an answer.
Yeah.
And so if we can leap directly to answer with talking to the AI, which is I think where we're getting, I think that'll make a huge difference and let us actually leverage that huge data sets.
Yeah, that's great. John,
That's an interesting point for me. I used to work for a quality improvement organization for Health and Human Services, CMS, and that's exactly what we did. We took all of these core measures, we took all this data across the nation, and we would use it for process improvement, feedback, but it was just generalized data. And I sometimes get in trouble because people get mad at me. I'm like, this, the data we're providing we've known this stuff. We know there's heart health issues in Dallas. You look at the food they eat. But now we're really starting to get to real data. We're getting into a level of we're tracking everything. I mean, from when someone walks into the hospital to a setting, we're tracking we have too much data. But now, though, the technology's caught up with those dreams. Now we can slice it and dice it. And I think we're really using it to do what healthcare is all about, is to intervene early and sort of implement these sort of preventative measures as best we can. And the other part of healthcare that's been challenging is that there are all these different care settings. we've been trying to get everybody on the same care plan and being able to document on the same care plan. So you have different EHRs, but now the data is being allowing us to do the things that with these disparate systems never allowed us to do. But now also we are being able to use that data and information in such a way that I think we're starting to see how it benefits changing either the patient journey, even again at the backside of the business side. So I think we're just at such a inflection point. We're so close to seeing how these sort of the ramifications and benefits of all this.
Yeah, I think it's an interesting, the data elements around AI, and when we think about this, are so fascinating, right? And I think it's also to your point, Eric, know what question you want to answer, and then let's go figure out what data we can pull to answer that question, right? We used to sort of think about it a long time ago, okay, now we have to go through a data cleansing exercise before we start any project. I think we've turned that on its head now, because the actual project is around answering the questions and making sure that we have the right answer, and let's ask the right question. And then we know the data exists to answer that question. It's just now, how do we access it, right? So yeah, super interesting, super important. Okay.
I think, and I was gonna say the other thing, I think today, we're focused on maintaining electronic health records. There's opportunities to do scheduling appointments and processing insurance claims. I think what's going to happen, the speed is going to get us so much closer to where we're preventing, and we're actually even taking these things from the hospitals and healthcare systems closer to the patient at home. That's what's going to happen. It's going to transform how healthcare is, everything about healthcare, and I think it's going to go that way completely.
Yeah, I think that too, and I think that would be really interesting, right? I think. Do you think, and do you see? So I think we all agree that that's the way it's going, right? That the AI is going to bring the healthcare and the data and the information to the patient much faster, and then the patient's going to be able to, with sentiment and a few other things, be able to react to these things. And then, but do you see that there's going to be an adoption? Like, how do you see that interaction with the patient? Is it like your Apple Watch? Is it online?
I think that adoption curves happen. It's technology in general has changed so much, and just within our own cultures, and the phone, all of this. I mean, I think, again, I really believe that these dreams and technology are at the same place now. But you're right. Now, healthcare though has always been so behind. They've got to catch up, and they've got to figure out how to not only just adopt that mindsets, but like we've been discussing, how do you integrate and implement those things so they are successful, and that they actually work, and that they are no longer just theories, but they're actually applied the correct way.
Yeah.
Yeah.
And I think that's where we come in, right?
Absolutely. Absolutely. Eric, you want to pile onto that?
Well, yeah, and I think that one of the important things to get adoption is going to be for people to have trust in what they're doing. So like right now, the 30-day return issue of, in other words, insurance companies really want to make sure that the hospitals are not having people treated well, and they're after they've been let out, they don't come right back. So what they're doing, a lot of them are doing right now, is they're basically giving a phone app to the people that has basically AI chatbot, and then connections to several nurses, a pharmacist, who basically has a daily check-in, and how are you doing? Is there anything I can do to help? The next gen of that is going to be, to me, is that affect analysis. I need basically a avatar that I can see facial expressions and can read my facial expressions. So if I can get somebody to look at a phone, I can have the cameras on there running, and I can see, when are you sure, when are you not, when are you telling me the truth, when you're not. So I might ask the question again. So, did you take your pills yesterday? Yeah. Ask it again. So those are the kind of things where we start to get a contextual conversations with real emotional connection. That's when I think the adoption is going to finally take place. And I think one of the things people miss is, I think that especially older people won't take to it. But what I've found is, older people, especially anybody, you don't want to feel like you're a burden. So if you're talking to an AI, sometimes it's actually easier. You don't have that feeling like you're imposing, you're taking someone's time. So actually done correctly, I think we can get much better connection, much more truthful connections using, a good AI.
I couldn't agree more. I've had the privilege of managing a couple care transitions teams, some care management teams, and we're dialing for dollars, we're talking to people, but I think you're exactly right. It's going to be personalized medicine, and so we're going to be able to tighten or lessen those screws and get it just right for each person. And that personalization in healthcare, I think that's what it is. People are going to be inspired, and they're going to be activated to actually get themselves involved in their own healthcare because it's personalized to them, and we've got the mechanics to do it.
Yeah, I mean, I'm going to give you guys a real world example as we sort of get to the end of the session here, but I have a relative who recently went through a health issue, and she was getting all this information. She said 3, 4, 5 doctors at a time, all of them giving her some of the same and some different information. If there were an AI chatbot that she could talk to, that could be like, who am I supposed to follow? What am I, like, follow up on questions? And Eric, it was the exact thing, right? Did you take your pills today? Every morning did you take your pills today? And I don't know, maybe, right? And so I think there is a level of that interaction, and I don't care what age you are. And you're right. I think that, nobody wants to be a burden to anybody, really, right? And so how do we make that user experience something that is inviting to work with, regardless of age, and provides the information and collects all that data and provides it back in a feedback manner that had sentiment, and that you can read, okay, am I questioning what I'm saying right now, or what the bot is saying? And I think I think we're entering an era that's going to be really, really powerful, and kind of an amazing, enlightening thing in the healthcare industry specifically, because it is so personal, right? And I think that's really exciting. So any last words that you guys want to say to wrap it up here?
Yeah, I have definitely. So in healthcare, they've been talking for 25 years about integrated systems. We've never accomplished it. But the integration that they weren't talking about is integrating the patient. And I think this technology is going to integrate the patient instantaneously and continuously in everything they do in their lives. That's the integration. And that's what's going to change healthcare.
I love that. I love that. Eric, any final words?
And I think if we go to where we're going, kind of would be a fantastic future where everybody's healthcare is bespoke. So the AI really understands your full health history across all those doctors, across all those procedures, across your genetic makeup as much. So things like CRISPR, which is some amazing new technology where you can actually fix some genetic things, is what they're coming up with. That in AI could mean that every person basically is going to have a very unique, specific, what drugs work for them, what drugs don't work for them, which is detrimental, which isn't, is something that I think the AI is going to hopefully lead us to.
I mean, these are exciting times, guys. This is really cool. I'm stoked for the future of AI in healthcare. I want to thank you both for being here with us today. This is awesome. And stay tuned for another episode of AI Got This coming